the impacts of how the impacts of climate change really contribute to or exacerbate health risks. So there's also a need to assess the current strategies being implemented by local communities, because we believe that there is richness in indigenous knowledge in what people have done over the years in curbing, health risks and climate and the impacts of climate change. And then thirdly, there's a need to propose a participatory prevention and response plan to deal with climate, health, and natural disaster risks. So that tripartite sort of combination, there's really a need for government stakeholders to put in place an effective and comprehensive response plan to deal with natural disaster risks and how it relates to health. So researchers, policymakers, practitioners, and communities need to work together to identify environments exposed to climate risks. Again, just pointing to aspects of deforestation, relative poverty, increased pressure on natural resources, inadequate health infrastructure that exacerbates the whole situation. So this knowledge should be co-developed by all stakeholders to develop to have effective strategies to reduce vulnerabilities and strengthen resilience. So that is the gist of this webinar. We invite you to join us today on this webinar on climate change and its impacts on health and disaster risks in Africa. We are going to be examining complex issues involved in managing risks and natural disasters in relation to people's health. We are also going to assess the effectiveness of local and scientific knowledge, very key, and I'm personally curious about it. Deployed in the coastal areas of Africa using Senegal as a case study. So our speaker today, our esteemed speaker, if I may, is Dr. Mamadou Ndong Toure, who holds a PhD in geography from the University of Gaston Berger, that is in Senegal. And I don't know if he's on call with us today. I'll just cede the floor to him immediately so that he can continue as the rest of us join in the reviews. So welcome, Dr. Mamadou. The floor is yours. In case you have any questions, please, or comments, please feel free to post those in the chats. And if we do not find any of that, I think we'll have a cut after this review. So yeah, we're really looking to learning from this session. Welcome, Dr. Mamadou. Over to you, please.
Thank you. Thank you a lot, Leah. I'm very pleased to be with you today and to share with the community our results from the research we have done last year. I don't know if you hear me well. If not, I will use the headphone.
Yes, we can hear you clearly.
Okay, so I have to just share my screen with you.
Of course.
Okay. So you have the screen.
We can see your screen. Just put it in presenter mode.
Presenter mode, okay. Okay. If it is okay, I can go ahead. So my apologies for the title. It is the last I have to translate. So you talk about it. It is climate change and health risk in the coastal area, in the island, Saloum Island in Senegal. And for the context element, we are on the context of climate change, coastal erosion in the Senegal regions, and it makes vulnerabilities, social vulnerabilities on families, also on girls, on women. We have also environmental vulnerabilities on forests and other land use. We have also health vulnerabilities. That is the aim of the project. And we have also economical vulnerabilities. And for all this, what we want to do is the mapping of the health risk associated with climate change. We have also to assess the response strategies implemented by local communities. And at the end, we propose a participatory prevention and response plan to deal with climate, health, and natural disaster risk. And the main questions we have on this research is that we are investigating the links between climate change and adjacent health risk. Our study focused on environment exposed to climate risk. And for this, we have coastal erosion, we have also flooding, we have waterborne disease, heat waves, salinization of land and water, and deforestation. And the target areas are also characterized by relative poverty, increased pressure on natural resources, and inadequate health infrastructure. I will come back on this health infrastructure. And the presentation of the study area, as I say, it is in the coastal area in Senegal and in the Saloum Islands. We have here on the map the localization of the area study, and with the all you see in blue is water. So we call it the Saloum Islands. It is about 45 islands. And in these 45 islands, we have one sanitary district, it is Jofior, and some other center of health in Lulsesen, who is also an island, Jofior, Fimla, and Marloch. It is on these 4 or 5 uh, medical center that we have done this research. And our objective is first to put in place a strategic framework to ensure regular interaction between climate and health through the development of research areas to help integrate climate change and climate variability into health development planning. And objective, specific objective, we want to identify the health risk associated with extreme climatic phenomena that can lead to a proliferation of disease transmission vectors. Here, intense rainfall, flooding, heat waves, and tornadoes will be correlated with the disease identified. And what we expect on results is that first, health risk related to climate vulnerabilities are mapped. Second, an inventory of the interactions between climate and health in Senegal is drawn up. Third, Ministry of Health professionals are better informed about climate change because we know that for the doctors, for the nurses, they know a little about climate change. So one of the expected results is to help them to know more the climate change. The impact of climate on human disease is better understood, as I say. And 5, the climate researchers and health professionals have relevant information and knowledge for planning and decision making. And at the end, we have good practice results and lessons learned on climate and health resilience strategies, which can be disseminated and shared as we are doing right now. And the methodology we use to have to do this research is approach methodological places great emphasis on participation from a research action perspective. We do not have only investigation with the classical tools from the university, but we work a lot with the participation tools, with working with the local communities. So the project also engaged with communities and other stakeholders using participatory approaches to put their voices at the center of the action. What we have done is to ask questions uh, on a focus group and to listen the community talk about climate change, talk about health and other initiatives they have to improve their health. We have also participatory methods will be the base on interviews, community workshops, group discussions, and interactive radio broadcasts. The participatory research will make it possible to analyze local perceptions of climate change, gather information on past climatic events, historical climate profile, for example, and the strategies that were implemented. And the result we obtained will guide the content of training sessions and the drafting of term of reference for prevention. The second part, okay, I do not translate this part, so I will go further. It is the literature review and also the analysis from documents. And at the and also we work a lot with the National Meteorological uh, Office, which give us data on satellite maps and also data on temperatures, data on rain, and with the uh, historical evolution. And after we have to compare the climatical data with the medical data from the medical centers. And at the end, the fact-finding mission enable us to meet the chief medical district office, who is a doctor, the head nurses, the community health workers, and the chairman of the target municipalities health committees. And as I say, we work a lot in very free talking with them, and that help us to identify the health risk associated with climate change in the coastal zone of the Saloum Island, like, as I say, flooding, violent winds, extreme heat, unseasonal rain, cold spells, coastal erosion, salinization. All these climate risks have incident in health for people and for especially for the young boys, the children, and also the women. In addition, a large amount of document, posters, pictures, press cuttings was compiled on the issue of climate change and the underlying health risk. And we have to stay a while in this Saloum Island. And for this mission, during the mission, we visited all the project intervention sites. We have gone on all this village, like Lulsesen, Dofior, Fimla, Marloch. It is sometimes we use boat, other times it is uh, cars, and other times also we use cats. So uh, we what we have done is now to see that health risk related to climate vulnerability. We also see interactions between climate and health in Senegal, health professionals' knowledge of climate change, we assess it, and the impact of climate on human and animal disease. Now, in Senegal, we're talking about One Health, which can um, tackle the health in general, animal health, and also human health. And this program is called One Health. We have also seeing the regional planning if they integrate climate and health, and at the head talking about climate and health resilience strategy, what they are doing right now to improve health in the context of climate change. And we are talking about the health personnel, and as we see, they know there is a remarkable impact on climate change on the health. It has led to an increase in health risk linked to climate phenomenon. Climate vulnerability has meant that several diseases that were rare in the area now persist. Malaria, asthma, rheumatism are very persistent in these areas. According to the Lulsesen principal nurse, malnutrition is a recurrent problem, as it is a secondary effect of droughts on agriculture production. The appearance of certain diseases, such as parasites, dermatitis, and allergies, is linked to the lack of sanitation and hygiene in a context of heat and humidity. The poor quality of water in some villages, which use well water that dries up and becomes full of sand and mud. It is also a finding key of this research. The impact of the climate on human health can be measured in terms of the exposure of people working in the salt marshes or mangroves. Exposures to the heat and the reverberation of the sun's crystals in the salt ponds causes eye problem. Cases of zoonose have been detected in Jifar, who is also an island, due to the cohabitation of people and animals. The isolation of certain islands, such as Sahar Island, which is uh, about 20 kilometers from Lulsesen, means that other forms of transport and disaster relief are required in the event of a natural disaster. The emergency means of transport, ambulance boat, and ambulance are replaced by carts, which all the risk that this entails. The interrelationship between climate and health can be also measured through seasonality. The probability of contracting certain disease is higher depending on the time of the year. Malaria in the uh, humid period, like hivernage in Senegal. We have also seen the commitment of community actors. These community workers are made up of relays, community health workers, as we call Bajango. It is like community aunties, radio station workers. They are often volunteers and act as an interface between the health structures, the local population, and local elected representatives. The protocol of raising families' awareness of the need to detect and monitor certain diseases, such as tuberculosis, is well known and can be applied. The community relays agree that following climate events like flooding, extreme heat, unseasonal rainfall, violent winds, visits to health facilities increase. They need to build their capacity on climate change, and they'll be able to monitor certain indicators within their respective communities. And at the end, we try to see what they are doing on this part of the community to be more resilient. And as we see that training and capacity building for local players, for local actors is very important. We see also that demonstration and promotion of good environmental practice is also important. In Jofior municipality on the island, they introduced a green label as a means of improving the living environment and preserving ecosystems and or as a quality indicator. So we have clean test town. And at the end, we see also how the community responds to COVID-19, for example, and what they do on the COVID-19 is also a real example to how the communities are dealing with disease and how they also challenge with climate change. It is all I have to share with you. I think that perhaps you have more times to discuss, to have questions, and also to share other experiences from the colleagues. Thank you a lot.
Thank you so much for your presentation, Doctor. So right now, I'll just like to invite any questions or comments from what has been presented to us. I think for me, what really jumps out from the outset is what are the linkages between climate change, health, and equity? Because you realize, Doctor, I think as you've presented, most of the health risks are associated with people from low-income areas, people who are heavily impacted by the adverse effects of climate change. So how can we ensure that we also rope in equity in the discussions interlinking climate change and health? And maybe as I cede the floor to you to just give your reflection on that, I can see from the call that we have some of our colleagues that are experts in the climate change and health arena. Emily Bolo and Brian Otieno, whom I think I will also give an opportunity after your reflections to just give a tidbit on what they are doing currently at the Africa Research and Impact Network, and how this interlinkage is being made by our organization as well, just giving the African perspective. So thank you so much. I'll invite you, Doctor, to comment on that.
Okay. Thank you a lot. Thank you for your questions. I see that for the local communities which are very impacted by climate change, it is a real impact to work on the equity and climate justice. I do not say it before, but we do this work on the thematic of climate justice for those peoples who are working, who are living in the coastal area, who do not pollute, who do not have green gas in the atmosphere, and which are already having the impact of climate change. So what we have done here is to talk with them, to help them to realize that climate change is here, and the health, the disease are in the other part, and to make them knowing that there is the real link. And as we see that, they know, but we do not have the real evidence, scientific evidence to tell them to share all this knowledge, all this commitment to the uh, international community. what we are thinking about is now to work on a platform which make together all these communities, insular communities, which are impacted by climate change, and to talk with one voice, to be heard by the international community and to be heard also by the national elected representative. So for this question, it is the commentary I want to do. Thank you a lot, Leah.
Yeah, thank you so much. I also see another question from Florence who asks, given the complex interplay between climate change, health, and natural disasters, what role do you envision for interdisciplinary research and collaboration in finding sustainable solutions? What role do you envision for interdisciplinary research and collaboration in finding sustainable solutions? So I don't know if you want to give a reflection on that, Doctor.
Yeah, no problem. I think that for the interdisciplinary, perhaps I do not say it in the first presentation, but we work with uh, many more disciplines. In our team, we have, I'm a geographer, we have a sociolog and also statistic and also anthropologist. We were about 5 researchers working on this, and all the member of the team are working without borders. What we see that there is an approach, sectorial approach on this kind of work, but what we have done here is interdisciplinary actions. And it makes sense. If you see the first or second slide, you see that climate change is on the 4 pillars for climate change. You see that we have economical impacts, environmental impact, social impact, and political impact. So we are convinced that interdisciplinary is important to build sustainable solution. So I agree with you that we have to work with the other disciplines.
Thank you for your reflections. I'd also just like to now invite Emily Bolo, if you are with us on the call, to just briefly comment on the work that you've also been doing on climate change and health. You know that last week we had a really impactful webinar, and some of just the pointers that could feed into the study and the presentation that has been made today. I don't know if you're with us, Emily, please. Are you with us, Emily? Okay, seems like Emily is not with us. I don't know if Brian, you want to comment on the same? Just on the ongoing climate change and health study that Erin is doing?
Yeah, thanks, Leah. First of all, I think the presentation was really well articulated. And yeah, I think the discussion around climate change and health, it's something that is really coming up around the development space. Erin is currently conducting a study on the consultation on transdisciplinary research on and action in climate change and health in Africa. And this is coming up due to the scenario where different stakeholders are working in silos. So you are working towards a specific goal, but you don't know, for instance, those in health, they are mainly focused on health. Those on climate change, they are just in their climate change sphere. And during this study, we conducted some form of a scan just to kind of see the different players within these particular sectors, but also kind of analyzing the policy space. And something interesting came out that policies are there, but you'll find policies around climate change, they touch on aspect of health, but policies around health, they don't touch on aspect of climate change, how climate change are affecting communities' health. And I think this is due to the disconnect where policymakers in the health space are not able to understand clearly how climate change impacts them. And there is not that the transdisciplinary collaboration between these particular entities. So this particular study has been funded by the Wellcome Trust, and it's being implemented by ARIN and APHRC, which is the Africa Population Health Research Center. And it's just to kind of inform Wellcome's investment on climate and health research in Africa. It's a very interesting study. We are kind of just trying to see who are the different stakeholders across Africa, what are the gaps, what are the opportunities, and what are the kind of avenues that we could leverage on to kind of spur collaboration. So last week we had our first webinar, just trying to look at the different players, the different stakeholders around climate change and health. And it was a very interesting discussion, just trying to see the current context of climate and health policy practice in Africa. We had very interesting deliberations from different stakeholders across Africa. And the next webinar will be on the 27th of this month, just trying to see the capacity and the training needs of the different stakeholders in climate and health research and practice. And I think it will be a very strategic one because usually we conduct the general capacity needs and the needs assessments of different institutions, but we usually don't take a deep dive into what do these particular stakeholders actually need from the ground. And I think we will be sharing with you in the chat a link to the survey, just to kind of share your ideas of what do you think on the current landscape of climate change and health, but also as a formal invitation to the webinar on the 27th, just to kind of share your opinions on the existing capacity and training needs of stakeholders around climate change and health. So back to you, Leah. Thanks.
Thank you so much, Brian, for giving us that overview on the project that is being undertaken. And I find it interesting because something that has been observed is that climate change experts have been working sort of on their own, and we have health experts also working on their various initiatives. But what Wellcome Trust is trying to do is to bring both these two sets of researchers together so that they're able to implement projects that give that clear interlinkage of climate change and health, seen as it affects vulnerable communities even more across Africa. So a really important and emerging area. Notably also in the upcoming COP28, the presidency has assigned a day for climate change and health. So it again highlights the importance of interlinking this great research focus. So I'll invite Washington to also give his comment before I go back to Dr. Mamadou for his reflection. Washington?
Leah, thank you so much. Thank you, Doctor, for your insightful presentation. And my question is, during your study, I'm sure that you may or you may not have come across persons with disabilities in your area of study. So just on top of your head, your thoughts, how can we safeguard persons with disabilities in the context of climate change and health? And how can we protect their rights? Because again, they are really disadvantaged during these extreme weather events and after effects, of course, whereby health comes in. Thank you.
And thank you so much for that. Dr. Mamadou, I don't know if you can take that.
Thank you a lot, Mr. Washington. I think that it is a very good question. And as you say, in the preparation of the mission, we were not having the person disability on head, but on the floor, when we talk about the communities, they put out this question, and how you will deal with the person of disability, how to help them to be more safeguard and to be more resilient from health and climate disease. And the information we have about the field is that for perhaps those who are using the chair, the rolling chair, they built ramp to access to the medical center. Now it is one of a little initiative they do. And the other side, we have the community health, the community health volunteers who sometimes can move and go to the houses they identify a person with disability. In the middle of the heat, sometimes they go there every Monday, every morning to give water because they can be perhaps dehydrated. So it is 2 or 3 questions that that talk about the person with disability. But I can say in the first time, in the preparation of the mission, we do not have it on heads, and it is the communities who talk about this. But it is, I think, a very good question. And if you see, this is a little project, and I perhaps plan to scale it up, because we are working in a little area, just in coastal area, and not in whole Senegal. And I think that if we one day have the possibility to scale up the project, perhaps we will have component, will have pillars on those people who are living with the disability. Thank you.
Yeah.
Thank you.
Just to add on that, reflecting on persons with disabilities, remember the recent Libya flooding that occurred. And when you think about those circumstances, only sort of quote unquote able-bodied people are able to quickly salvage themselves or their property, etc. And you're thinking about persons with disabilities, they do not have that ability, they do not have that agency to do certain things for themselves. So it would really be important for us to look into that aspect. And I hope that it's possible for the project to be scaled up to incorporate them. And also, perhaps I'd also like to on elderly persons, because when you're talking about heat waves, when you're talking about the cold seasons, they are mostly affected. And their needs should be incorporated in any policy interventions that we have, in any studies that we have. The applied should be incorporated. So just maybe just asking, in the small area of study that you have been working in, have you considered or incorporated the aspects on elderly persons within the community? Thanks.
Yeah, for the elder, we have a focus on them because when we talk about the doctors and also nurses, they tell us that the older persons already suffer by dehydration, and because they can't know if they are thirsty or not. So, in the first meeting we have with the medical sectors, they told us to make a focus on elders, on older person, on elders. And what we have done is we invite them, some of them, on the group focus group, and asking about what a project can do for them to help them to be more resilient in a case of climate crisis. And they give us a little list of control. First, do you have enough water? Second, do you have a hat or to preserve yourself from the sun? Third, do not work on the hot period of the day, and you have also to have the coat and other uh, protection, cover protection. So we have these solutions coming up to us by the uh, older person who were with us on this on this research. So I think that it is important to take account the elders, but to take account also the disabilities, and and what we are real focus is on children. It is with children, it is the scholar children, and the project is now uh, going to approach the Green Climate Fund, and to work on health and climate change, but with a real focus not only on research, on evidences, but with operational actions that help to build resilience for climate change. And we are doing this job now with Save the Children, the NGO, international NGO Save the Children, and the Ministry of Health from Senegal, with the funding from the GCF. So what I want perhaps to share is that sometimes small grants can help to have evidence to build a bigger project. And I say that the small grant is like seeds, and it can help to have a big crop. Thank you for the question.
Thank you so much for your insightful comments. Really, indeed, the small seeds that we are sowing through the small grants, I think, can lead to implementation of bigger projects in the space of climate change and health. I think that's a really good place to sort of wrap up today's review, brief as it has been. I don't know if any of us has any last comment or question. I don't want to lock anyone out. If not, thank you so much, Mamadou, for your time. And please do share your presentation with us because you're really interested in that area of focus. So it will be a pleasure to sort of learn from what you have already done. Otherwise, I have been your chair, Leah Aoko, and see you next Friday, same time. Thank you.
Yeah, thank you. Yeah.